Yeah, thanks a lot for this introduction, and I don't know how you felt while listening, also thinking of your own life. I think it depends on how old you are, but at least when I grew up, this was also the only idea I could imagine, to marry one man and become old with this. Okay, this is how also my life changed. So it's, yeah, we are now, I'm struggling with this thing here. Okay, so I would like now open the floor. Okay, it's in an organized way, as you were asked by the organizers to raise your voice before, to indicate that you would like to contribute to this session with a statement. And as yesterday, we start with the governments, and then as another kind of package, we then go to statements coming from civil society, academia, experts. And the moderator yesterday, Petra Bayer, already highlighted our traffic light here. So please be precise, be short. The more precise and short you are, the more opportunities are for others to contribute. And the first government I would like to ask to contribute is the government from Uzbekistan.
Уважаемая госпожа председатель, прежде всего хочу поблагодарить вас за возможность озвучить позицию нашей страны в обсуждаемых сегодня и вчера вопросах. На сегодняшний день по народонаселению Узбекистан приближается к 30-миллионному рубежу. Более 35% населения – это дети и подростки до 18 лет. Около трети населения составляют женщины репродуктивного возраста. Получивший всеобщее признание принцип здравоохранения «здоровая мать, здоровый ребенок» по своей сущности явился объединяющим и мобилизирующим обращением государства к населению. Стал тем приоритетом, который был поднят на государственный и общественный уровень. За период после Каира была создана мощная законодательная основа для развития здравоохранения с вытекающими государственными программами. В 1998 году был издан указ президента о государственной программе реформирования здравоохранения, который определил на многие годы вперед концепцию развития медицинского обслуживания населения, основанной на всеобщей доступности и социальной справедливости. Была создана сеть хорошо оборудованных сельских врачебных пунктов, количество которых более 3200, которые оказывают помощь сельскому населению и где практикует врач общей практики. Созданы службы специализированной помощи беременным и женщинам репродуктивного возраста в виде сети перинатальных центров, научно-практических центров акушерства и гинекологии, центров репродуктивного здоровья населения, где оказывается помощь и поддержка подросткам. Создана сеть скрининга беременных на аномалии развития детей, что помогает предотвращать ежегодно рождение более 2000 детей с различными серьезными пороками развития. Со стороны правительства проводится активная работа по улучшению питания населения. Успешно реализуются программы по поддержке и пропаганде грудного вскармливания, бесплатному обеспечению витаминными, минеральными комплексами беременных женщин и детей до 5 лет. Проводится промышленная фортификация муки и йодирование пищевой соли, что позволило улучшить рост и развитие детей и значительно снизить показатели детской заболеваемости и смертности, уменьшить в 2 раза анемию среди женщин фертильного возраста. В Узбекистане наряду со многими действенными программами по улучшению репродуктивного здоровья осуществляется программа по обеспечению населения контрацептивными средствами за счет государственного бюджета. что позволяет продлевать семьям гравидарный интервал до 3-4 лет. В результате предпринятых действий материнская и детская смертность снизилась более чем в 3 раза за прошедшие 20 лет. На 7 лет увеличилась средняя продолжительность жизни населения. Наряду с рядом достижений в сфере здравоохранения, конечно же, остается целый ряд вопросов, требующих дальнейшего решения. Приоритетными направлениями в дальнейшем развитии здравоохранения в Узбекистане, так же, как и во всем мировом сообществе, остаются дальнейшее улучшение качества жизни, качество медицинской помощи, предотвращение подростковой беременности и подростковых родов, усиление деятельности, направленной на повышение медицинской культуры населения, информированность в вопросах охраны репродуктивного здоровья и здорового образа жизни, укрепление здоровья женщин и детей и большее привлечение мужчин к вопросам формирования здоровой семьи и крепкой семьи. Узбекистан и дальше будет стремиться к достижению целей развития тысячелетия и других задач, которые будут поставлены после 2014 года и будут отражены в декларациях ООН. Спасибо за внимание.
Yeah, thanks a lot for sharing this news, this good news. I am now would like to ask the Netherlands to speak up.
Thank you, Mrs. President, Excellencies, distinguished delegates. This is a very promising conference. I especially underline the importance of the participation of NGOs. It is for that reason that the Netherlands delegation has included Rutgers WPF as a member of our delegation. I strongly applaud the interventions made yesterday by the youth representatives. It has been 19 years since the adoption of the groundbreaking programme of action at the International Conference on Population and Development. The Cairo Agenda presented a transformative shift to the respect, protection and fulfilment of human rights of every individual, especially with regard to sexual and reproductive rights. It also stressed the importance of gender equality and the empowerment of women and girls, particularly when it comes to sexual and reproductive decision-making. The Netherlands is widely known for its stance on promoting sexual and reproductive health and rights and breaking unhelpful taboos around sexuality. We strongly believe that every individual has the right to self-determination and to make free and informed choices in relation to one's body, sexuality, and the number, timing and spacing of one's children, free from violence, coercion and discrimination. Realizing sexual and reproductive health and rights is crucial in sustainable development, personal well-being and social justice. Therefore, the Netherlands is a strong supporter of the ICPD programme of action, both in our national policies as well in international cooperation policies. In order to empower women and girls, men and boys to make informed and free choices, the government of the Netherlands provides sexual and reproductive health and rights information, education and services. This includes sexual education, access to a variety of modern contraceptives and access to STI services and safe and legal abortion services for individuals and couples, including adolescents, young people, unmarried people, people living with HIV and LGBT. For young people under the age of 21, contraceptives are part of the basic health insurance package. As a result of these efforts, the Netherlands has exceptionally low teenage pregnancy and low abortion rates. It is precisely what Mrs. Clinton explained in the video. The Netherlands supports comprehensive sexuality education according to evolving capacities of children and young people. An example in primary schools is the Week of Spring Fever program, in which children learn about love, respect, body changes, relations and gender. Other countries in Europe consider to adopt this program as the outcomes are positively evaluated. In 2012, the government of the Netherlands adopted a policy for all secondary schools to provide sexual education, including education on respecting the rights of lesbian, gay, bisexual and transgender people for young people between the ages of 12 and 15. The right to choose your own partner and the right to marriage applies to all people. The Netherlands was the first country in the world to legalize same-sex marriage in 2001, and among the first countries where same-sex couples can adopt children. Globally, there is a growing awareness and political will to end child, early and forced marriage. Although the extent of early marriage varies between regions and countries, evidence demonstrates that the highest rates are found in West Africa, Asia and the Middle East, North Africa. But also in Europe and in the Netherlands, we are confronted with the negative effects of early and forced marriage. The Dutch government is working on improved legislation to protect girls against early marriage, and a multi-sectoral plan of action on forced marriage has been submitted to Parliament. Although the 20th anniversary of the Programme of Action shows achievements in many aspects of the agenda, more needs to be done in the European region as well as elsewhere. Progress on crucial elements of the Programme of Action is insufficient, such as young people's sexual and reproductive health and rights, preventing child, early and forced marriage, access to safe and legal abortion services, access to family planning and contraceptives, gender equality, combating gender-based violence, and the right to express diverse sexual orientations and gender identities. The Netherlands believes that the protection, respect and fulfillment of reproductive rights and sexual rights are key to personal well-being, social justice and sustainable development. This is reflected in the recently published human rights policy as well as a development cooperation policy. In the latter, sexual and reproductive health and rights is one of our 4 policy priorities. The government of the Netherlands works nationally and globally with different stakeholders, such as civil society organizations, to advance SRHR. Among these stakeholders are young people and youth organizations, as we believe that they have the right to be meaningfully engaged in decision-making at all levels in policies and programs that affect their lives. The coming years are important for the advancement of sexual and reproductive health and rights and the other ICPD-related areas. The ICPD operational review process offers a unique opportunity to contribute to this new paradigm by looking at the root causes of poverty, such as gender inequality, social injustices, and the lack of respecting, protecting, and fulfilling human rights, including sexual and reproductive rights. As part of this review process, the Netherlands is honored to host, together with UNFPA and OHCHR, the ICPD Human Rights Conference next week. Now is the time to take stock, to make sure we fully implement the Cairo Programme of Action, and to ensure that the paradigm for the future is based on a comprehensive understanding of human rights, dignity and equity. The Netherlands will continue to advocate for the ICPD agenda and SRHR as key components for this post-2015 development framework and the development of the Sustainable Development Goals. Thank you.
So we moved from the Netherlands not very far to Germany, to my home country. The floor is yours.
Thank you. Mr. Chairman, Madam Moderator, distinguished delegates, ladies and gentlemen. Germany is convinced that rights-based family planning and maternal health are integral parts of sexual and reproductive health and rights. They are essential and critical elements of sustainable development efforts with particular impact on the empowerment of women and girls. Germany continues to strongly advocate for a rights-based and gender-sensitive approach in family planning and contraception, comprehensive sexuality education, engagement of boys and young men in sexual and reproductive health, as well as linking of HIV and AIDS in sexual and reproductive health. Through the initiative on rights-based family planning and maternal health, German development cooperation aims to improve the knowledge about acceptance and success of modern family planning methods and services, and to increase the number of births attended by health professionals. Germany emphasizes on the benefits of a sound and disaggregated data collection with information on SRH, covering not only married women, but also unmarried women, teenage girls and boys, older women and men, to plan and implement tailor-made interventions and policies to foster SRHR. With demographic and epidemiologic changes, as well as changing societies, also the sexual and reproductive health needs of people are changing. Germany therefore welcomes a life course approach to SRH and emphasizes on the importance of addressing the special needs of the diverse groups in the societies, including lesbians, gay, bi, transgender people from birth to old age. Germany notes the rise of HIV infections in Eastern Europe and Central Asia and calls for ending stigma and discrimination towards people living with HIV and AIDS. Since 1994, a lot has been achieved to promote the sexual and reproductive health and rights of people all over the world. But with remaining high rates of unmet need for modern contraception, unwanted pregnancies, and maternal mortality, much more needs to be done. Therefore, Germany supports the High-Level Task Force for ICPD in order to ensure the preservation and progressive advancement of the principles of the Cairo Conference, and calls upon all partners to support the further implementation of the Cairo Program of Action beyond 2014. Thank you for your kind attention.
Yes, thank you very much. And we move from Germany to Georgia.
Ladies and gentlemen, I have the pleasure on behalf of the government of Georgia to present both the snapshot of the national health system reforms and the latest dynamics around sexual and reproductive policies and achievements in the country, in line with Cairo Program of Action. After general elections of 2012, the new government administration came into power with a strong determination to improve social and health status of the population. The strong political will was translated into unprecedented, almost twofold expansion of state budget resource allocations for health. The second major step towards securing enjoyment of health rights, and particularly the reproductive rights of the population, was the launch of Universal Healthcare Program in 2013. Last year, only 50%, half of the population, were covered either by public or private insurance, and 2.2 million population had no financial security mechanisms for enjoyment of their health rights. As of today, every citizen of Georgia is guaranteed by basic health care package, and the package includes both antenatal and basic and emergency obstetric care services. The government focuses both on quantitative and qualitative aspects of the reform, and we are in the process of putting in place the total quality management system that will include the accreditation mechanisms, regionalization of perinatal care, rational use of drugs, and other proven instruments of cost-effective and high-impact interventions. As for the sexual and reproductive health agenda, the country has attained a number of significant gains. This includes substantial gains in maternal, infant, and under 5 mortality, reduction of abortion rates, and increase in contraceptive prevalence rates from 20% to 54%. And one shall underline that increase of contraceptive prevalence rate happened in line with increased fertility rates in the country. Screening programs for breast and cervical cancer were introduced in 2005, and universal access to HIV diagnosis and treatment has been attained and maintained since 2003. Support from UN agencies, and particularly UNFPA, has been substantial in achieving these results. Over the last 2 decades, the organization was supporting provision of family planning commodities, training of family doctors, development of guidelines and protocols, reproductive health initiatives for use in the Caucasus, and youth-friendly services. UNFPA has also helped the country in introduction of cancer screening programs in 2005 and in generating data for decision-making through 3 rounds of reproductive health surveys. We hereby look forward to continuous partnership to bridge the remaining gaps in sexual and reproductive health response. The government of Georgia considers stronger positioning of Cairo agenda, including further reduction of maternal and infant mortality through more robust regulations, capacity building, monitoring, and accountability for anti, peri, and postnatal care services. We will focus on more systematic integration of high-impact sexual and reproductive health interventions, including contraceptive commodities, screening programs, and gender-based violence into the mainstream of primary healthcare services, thus bringing the essential services closer to the population. We will focus on financial sustainability of HIV and STI services for youth and most at-risk groups. As the countries in the region become richer and less eligible for global public-private partnership funding, we have to put the guarantees for non-interruption of HIV and STI diagnosis and diagnostic and treatment services. And finally, we have to be more focused on developing and mainstreaming aging policies into the overall national health sector planning. After the dissolution of the Soviet Union in 1990, Government of Georgia and UNFPA co-hosted the very first international conference From Abortion to Contraception. And two decades later, we remain committed to sexual and reproductive health policies and look forward to continued partnership with donor community and technical partners for attainment of Cairo conference targets. Thank you.
Yeah, thank you very, very much. And we move now to the other side, to Belgium.
Mrs. Chairperson, distinguished delegates, dear participants, let me first of all thank UNECE and UNFPA for the initiative taken and the work done over the past years. Since the adoption of the Cairo Programme of Action, Belgium showed itself a dedicated and proactive player in the field of sexual reproductive health and rights. Belgium has taken several legislative and policy initiatives to strengthen the rights of sexual minorities. In 2003, Belgium was the second country in the world where same-sex marriages were legalized. In 2007, a new law was adopted penalizing all forms of hatred and discrimination, including discrimination on the basis of sexual identity. At the beginning of this year, the government launched an action plan against homophobia and transphobia, proactively addressing discrimination against sexual minorities. In the spirit of the focus of the United Nations on the rights and needs of young people, as illustrated by the work of the Secretary General, UNFPA and UNECE, Belgium has one of the lowest figures of teenage pregnancies worldwide, thanks to high-quality comprehensive sexuality education at schools, access to youth-friendly services, including abortion services, and through the availability of free contraceptives for young people until the age of 21. As in several other UNECE countries, one of the main challenges are the concentrated HIV epidemics among African migrants and homosexual male population. Belgium addresses this by targeted HIV prevention programs as well as through accessible and non-discriminatory health services. Specific HIV prevention programs for sex workers and harm reduction programs for injected drug users have prevented a high HIV burden among these key populations. In the fall of 2013, Belgium will launch a national action plan on AIDS. This plan will dedicate attention to the needs of key populations and young people and the fight against HIV-related stigma and discrimination. Currently, the federal government, together with the regions, is also drafting a new national action plan running through 2018 against intimate partner violence and other forms of violence, prioritizing the fight against sexual violence. On the regional level, frameworks on sexuality and sexual integrity for the sport and youth sectors were also developed. Our policy on sexual and reproductive health and rights is not only applied internally, but has external implications as well. Sexual reproductive health and rights remain a priority in the updated Belgian National Action Plan on the implementation of UN Security Council Resolution 1325. The Minister of Development Cooperation has expressed his support to include sexual reproductive health and rights in the ongoing work on the post-2015 framework, flagging the importance of a strong gender dimension in the upcoming framework. the Belgian Development Corporation recently implemented a policy note prioritizing sexual reproductive health and rights by 1. Integrating this issue in general health care, 2. Combating sexual violence, sexual exploitation, trafficking in women and children, and harmful practices such as genital mutilation, sexual initiation rituals, and infant marriages. And 3. Addressing sexual reproductive health and rights during emergency situations, conflicts, and peace-building processes. Recently, the Minister for Development Cooperation has planned to increase the core contributions for UNFPA from 5.7 million euros in 2013 to 7 million euros in both 2014 and 2015. For UN Women, from 2.15 million euros in 2013 to 4 million in both 2014 and 2015. And for UNAIDS, to 4.4 million in both 2014 and 2015. Belgium, together with other EU member states, plays a continuous advocacy role with and within the EU to integrate sexual health and reproductive health and rights in all EU policies. Mrs. Chairperson, distinguished delegates, dear participants, on the eve of the 20th anniversary of the Cairo International Conference on Population and Development, which gave such a strong impulse to the promotion of sexual health and reproductive rights, we can look back and conclude that we have booked several successes. However, there remain a number of persisting and emerging challenges in the field of sexual reproductive health and rights in the UNECE region. The HIV burden among key populations, the low coverage and antiretroviral treatment in Eastern Europe and Central Asia, the specific needs of vulnerable groups such as migrants, Roma, and people with disabilities, or suffering sexual or gender-based violence, or the morbidity and mortality due to unsafe abortion in a number of countries, the low prevalence of modern contraceptives. Contraceptive choice should be part of coherent sexual reproductive health and rights policies and accessible and equitable family planning services. Within the UNECE region, we observe serious differences in the way contraceptive choice is approached. This highlights the need for a continued level of political focus and financial support for sexual reproductive health and right policies, so women are able to make an informed choice and have equitable access to modern contraceptive methods. This is crucial in order to help them to decide whether and when to have children, which is an internationally recognized human right. All these issues are imperative for women's empowerment, gender equality, and sustainable development in general, and should be recognized as critical components of a single, comprehensive, and coherent post-2015 framework that reinforces the international community's commitment to poverty eradication and sustainable development. Addressing these priorities is only possible through strengthened international solidarity and cooperation. Countries should prioritize these challenges by emphasizing good governance, by making domestic resources available, by involving civil society actors, and by addressing legislative and cultural barriers that impede access to sexual and reproductive health services. The further implementation of the Cairo Programme of Action and the reflection of its agenda in the post-2015 framework require strong global players and international leadership. The United Nations and within the UN system, UNFPA plays a leading role in this. It should continue to have a strong mandate to do so. Let me reiterate our strong will to fully review and assess the implementation of the Programme of Action to date, taking into account the need for a systematic, comprehensive, and integrated approach to population and development issues as we move towards a post-2015 development framework. Thank you very much.
We will close the list of governments with France, please.
Merci Madame la Présidente. Au nom de la France, permettez-moi tout d'abord de remercier les intervenantes pour leur excellente intervention sur un sujet d'une importance majeure. L'égalité entre les femmes et les hommes est un impératif éthique et politique. C'est aussi un facteur d'efficacité que la France place en priorité dans ses politiques nationales et dans son action internationale. Cette égalité doit être assurée tout au long de la vie par l'intermédiaire d'une politique sociale qui soient sensibles au genre. Donc, en France, cela commence par une éducation au respect, à l'égalité, à la sexualité, afin de favoriser l'adoption de comportements responsables dès le plus jeune âge. Nos dispositifs visent ensuite à garantir le libre choix des individus en matière de reproduction. Pour cela, le gouvernement français met en œuvre ce principe fondamental à travers le renforcement de l'accès aux services, aux produits, à l'information en matière de santé sexuelle et reproductive, et notamment par l'amélioration du remboursement et la gratuité pour les mineurs en matière de contraceptifs, la prise en charge à 100% des interruptions volontaires de grossesse, mais aussi la prise en charge gratuite et anonyme de l'accès aux centres de dépistage, au VIH/SIDA et aux maladies sexuellement transmissibles. La prévention joue un rôle déterminant dans l'efficacité de ces dispositifs. La campagne de prévention VIH/SIDA en France ont contribué à modifier les conditions d'exercice de la sexualité. L'augmentation spectaculaire en France du recours aux préservatifs lors du premier rapport sexuel atteste de l'efficacité de ces campagnes. Depuis les années 2000, le taux d'utilisation de contraceptifs est maintenu à 80%. Si le recours aux préservatifs est très élevé lors du premier rapport, il décroît sensiblement avec l'âge. Ainsi, la contraception d'urgence s'est très fortement développée depuis les années 90, depuis l'année 99, date à laquelle elle est devenue accessible en pharmacie sans prescription médicale. Aujourd'hui, en France, une femme sexuellement active sur 5 déclare avoir eu recours à la contraception d'urgence. Pour les jeunes femmes de 15 à 24 ans, ce recours concerne près d'une jeune femme sur 2. Madame la Présidente, le plus grand défi de nos sociétés contemporaines est de parvenir à garantir le libre choix des individus dans leur vie familiale et privée, en maintenant notre capacité à assurer leur sécurité économique et sociale. Les modes de vie familiaux ont connu de nombreux changements durant ces dernières décennies en France, en Europe, mais aussi dans le monde. Nos politiques sociales doivent nécessairement s'adapter en conséquence afin de préserver le bien-être des personnes, garantir leurs droits fondamentaux à l'égalité, la sécurité et à la dignité. C'est pourquoi la France a développé, dans le cadre de sa politique familiale, des mécanismes qui permettent une meilleure conciliation entre la vie privée et la vie professionnelle. Cela passe par une amélioration du mode de garde et de prise en charge des enfants, notamment avec l'ouverture de 275 nouvelles places en crèche dans les 5 ans à venir, par exemple. Mais aussi dans le cadre du plan pluriannuel de lutte contre la pauvreté et pour l'inclusion sociale, nous avons renforcé l'aide économique à destination des familles monoparentales, dans lesquelles le chef de famille est le plus souvent une femme. Enfin, la France est fière d'avoir rejoint les 8 pays européens qui, successivement, depuis plus de 10 ans maintenant, ont ouvert le mariage aux couples de même sexe. Il s'agit d'une loi de liberté, d'égalité et de fraternité qui fait écho aux valeurs que notre pays partage avec d'autres. Madame la Présidente, pour conclure, je souhaiterais affirmer l'engagement de la France pour la mise en œuvre du programme d'action du Caire. Les droits relatifs à la santé sexuelle et reproductive doivent être garantis au sein des législations nationales. La France est déterminée à inscrire l'égalité entre les femmes et les hommes dans toutes ses dimensions au cœur de l'agenda du développement futur. Je vous remercie.
So, thank you very much, and we move now to the WHO.
Thank you very much, and distinguished chairpersons, ladies and gentlemen. I would like to convey greetings from Zuzana Jakob, Regional Director of the WHO Regional Office for Europe, and WHO staff who are assisting 53 countries of the European region in improving health, including sexual and reproductive health of population. I would like also to thank UNECE for coordination of ICPD Plus 20 activities in the region, and especially our long-standing partners, UNFPA Regional Office for Eastern Europe and Central Asia, who are working together with WHO in the area of sexual reproductive health and rights, regionally as well as in the countries. We are to prioritize in our lives, and I had to prioritize the focus of my talk, this intervention today. And I will focus on diversity and inequalities of sexual and reproductive health among countries and within countries. When I was in Cairo 20 years ago, I was speaking on behalf of my country, of my small country, Latvia, on the Baltic Sea. Now, 10 years, I am already speaking on behalf of World Health Organization. Things have changed. 5 countries are those I have not visited from all 53 countries, and I 20 years after Cairo, I have full evidence to say that we still in Europe, in rich and prosperous Europe, we have maternities without running water or healthy heating. We have pregnant women who do not know where and that is the uterus and whether they have it at all. There are countries where violence of intimate partners is considered a norm. Or there are countries, and that I experienced just a month ago, where word sexual restricts you to the web page, including sexual and reproductive web page of WHO. You can't open it, it's restricted. There are countries where unintended pregnancies in adolescence ends in suicide, and that is 20 years after Cairo. Health equity cannot be achieved without addressing inequities and making the right to health a reality. Access to family planning and safe abortion services remains among challenges of sexual reproductive health in the European region, and I would say even bigger challenge during the last 5 years. Differences in collecting data, reporting data, and contraceptive prevalence really differs among those 53 countries of our region. And I really would ensure and try to, what Anne said, please use every opportunity for the survey so at last, 20 years after Cairo, we have reliable and comparable data between countries and can define our way forward. Often data about unmet need for family planning for the poor, Roma, illegal migrants, disabled, or young people is missing. DHS confirms big differences and the impact of social determinants of health. And some conclusions. Yes, there's high diversity in Europe. There are vulnerable groups in relation to sexual reproductive health, and they are changing. Advocacy work in the area of sexual reproductive health and rights should be improved. No progress in development and improvement of sexual reproductive health without intersectorial collaboration. And that I can say because WHO mostly works with with ministries of health. However, I really think that we are to try to make it broader. Linking social determinants of health, health environment with life course, including sexual reproductive health, is one of our next goals. And here I would like to focus on Health 2020, the policy document that has been approved by all 53 member states last September during the Regional Committee of European WHO region. There are two main strategic objectives: reducing inequalities as well as better governance. I would like to call countries to ensure that sexual reproductive health and rights is part of the National Health 2020 policy documents, that clear targets are developed and monitoring mechanisms established. WHO is ready to assist countries in developing that process. I have full trust in our rapporteur that sexual reproductive health and rights will be well reflected in the final report of this meeting. And I fully support youth intervention yesterday that sexual and reproductive health and rights will not be lost in discussions on demography, life course, or maybe even older people. Thank you very much.
Thanks a lot for sharing WHO's view on Europe, on the sexual reproductive health situation in Europe. So I move now to the youth. We talked a lot about the youth. Now Astra Youth. I don't know who is going to speak.
Honorable delegates, my name is Medea Khmelidze and I represent Astra Youth here, and I've been honored to bring up the youth voice concerning sexual and reproductive health and rights of young people and adolescents within UNECE region. Young people's and adolescents' sexual reproductive health and rights has been the issue of discussion for so long. Still, there are lots of controversial opinions regarding at what extent youth and adolescents should experience their fundamental rights to lead healthy and pleasurable sexual lives. Various international conventions and declarations, as well as consensus documents, have been addressing sexuality, sexual and reproductive health and rights of young people and adolescents, making the governments accountable to comply with their obligations. In daily life, we, young people and adolescents, are often deprived of our fundamental rights. Our needs are often neglected. Our voices are often manipulated or not being heard. The root cause of such informed decision of our governments, inability to consider us as sexual beings, and therefore deserving of respect, protection, fulfillment of our sexual and reproductive rights. Despite the commitments governments made to a rights-based approach, where the rights of individuals are in focus, a difficult political climate and strong controversial forces have contributed to a lack of political will and funding for making this happen. Recognizing people's sexual and reproductive rights is needed for an equal and just society where young people are able to be the actor of change. We still lack universal access of non-judgmental and non-discriminatory, comprehensive, integrated, youth-friendly sexual and reproductive health services and information. This includes our access to safe and legal abortion, ranging of contraceptives, including emergency contraception and testing and treatment for HIV and other sexually transmitted infections. For us, accessibility means knowledge of the location of youth-friendly services, that they are accessible by public transit, free of charge and with flexible opening times. Legal barriers such as parental and spousal consent laws also often prevent us from seeking services and information. We need our access to these services and information to be without fear of stigma and discrimination. Too often, we are prevented from accessing essential services for fear of discriminatory and judgmental attitudes of service providers. Fearing such treatment, young people and adolescents often avoid seeking essential treatment and information. We still lack access to comprehensive sexual education that is needs and rights-based and seeks to equip young people and adolescents with the knowledge, skills, attitudes, and values we need to determine and enjoy pleasure and our sexuality, physically and emotionally, individually and in the relationships. It views sexuality holistically, and within the context of emotional and social development, it recognizes that information alone is not enough. When empowered regarding our sexual and reproductive health, we are better positioned to prevent the transmission of sexually transmitted infections, including HIV, as well as unwanted pregnancies. We are also able to counter negative gender stereotypes by themselves. And finally, marginalized groups, especially young women and girls, and young people with diverse sexual orientation, gender identity, and expression, are often those most lacking in access to sexual and reproductive health services and information, and therefore most vulnerable to violence and harmful traditional and cultural practices. Addressing root causes is critical to eliminating stigma and discrimination, violence and inequalities, and can be achieved by adopting a positive approach to sexuality, recognizing young people's sexual rights, addressing the systematic denial of rights, and providing access to justice. We restate that sexual and reproductive rights as a part of the agenda are fundamental rights. We call for actions that lead to the full integration of the right-based and youth interest-oriented recommendations to influence our future policy actions and synergies with the post-2014 UN development and the post-2015 development agendas. Meaningful participation of young people to make the contribution in the stating the conditions for the SRHR well-being is one of the crucial components of building the democratic and strong society where young people are respected and seen as the present stakeholders leading to desired future. Thank you.
Yeah, thank you very much. And from the delegate from Astra Youth, we move now to a delegate from Choice for Youth and Sexuality.
Honourable delegates, civil society representatives, Ms. Baer. My name is Stefan Hennitz. I am here to represent Choice for Youth and Sexuality, a youth-led NGO from the Netherlands. We welcome the opportunity to speak at this session, and we would like to address a special thanks to UNFPA for meaningfully involving young people in this conference. The fact that I'm so closely following an intervention by one of my peers might give you the idea that young people have plenty of opportunities to participate in global decision-making processes. But unfortunately, this is not the case. As the UNECE regional report shows, youth groups are rarely included in partnerships with governments and therefore lack the chance to influence those decisions that affect them most in life. This has many consequences for the implementation of youth-oriented programs, as these programs often fail to meet the real needs of adolescents and young people. We therefore urge governments, in collaboration with civil society, to form partnerships with existing youth-led organizations, to remove legal and regulatory barriers that hinder the meaningful participation and empowerment of adolescents and young people, and to develop programs and mechanisms to support the formation and further development of youth-led organizations. Sexual and reproductive health and rights is a very important theme for young people because it is highly interlinked with other themes that are crucial to us, like education and employment and freedom from violence and discrimination. Universal access to sexual and reproductive, youth-friendly health services, including access to modern contraceptives, legal and safe abortion, and comprehensive sexuality education, is key if we want our generation and future generations to be resilient and productive. Since the adoption of the ICPD Programme of Action, much progress has been made towards achieving universal access to SRH services, especially in this region. Yet the UNECE report also shows that more attention is needed to achieve access for persons with disabilities, from poor backgrounds, migrants, young people living with HIV, and other marginalized groups. Many adolescents and young people fall under these categories and face obstacles that prevent them from accessing SRH services. Some of us are discriminated against based on our age, sex, sexual orientation and gender identity, or legal status. In some countries, young people still require parental or spousal consent to access SRH services. All legal, financial, and social barriers that hinder us from accessing the care and information we need to live a healthy and happy life also prevent us from becoming active citizens and contributing to economy and society. This brings us to a serious gap in the UNECE report: the absence of a rights-based discourse. We can and should not talk about health and rights separately. To ensure universal access to SRH services, everybody should have the right to access them. We urge governments to put human rights at the center of the sexual and reproductive health and rights discourse, and to acknowledge sexual rights as human rights. Governments should do everything in their power to protect the rights of young people. All structural, legal, and policy and social barriers that hinder the fulfillment of young people's sexual rights should be removed. Mechanisms should be developed that hold governments and public institutions accountable for the protection of young people's human rights. And governments and civil society should allocate adequate resources to create enabling environments for young people in which we are empowered to ensure our rights. This includes the need for more research to assess adolescents and young people's needs and the barriers we face. Government should invest in building the capacity of young people to collect and validate data in order to ensure youth-friendly monitoring and evaluation mechanisms. Young people are not a homogeneous group. SRHR programs aimed at young people will only be truly effective when the diversity of our challenges become apparent and we are meaningfully involved in every step of the process, from research to implementation. I will end this intervention by repeating our two main points. Put human rights at the center of the SRHR discourse and acknowledge sexual rights as human rights. This action should not be limited to ICPD beyond 2014, but extend to the post-2015 development agenda. Only when human rights are at the forefront of discussion can we guarantee universal access to SRH services. And two, form equal partnerships with adolescents and young people and youth-led organizations. This action should not be limited to ICPD beyond, We should also provide young researchers and youth-led initiatives and organizations with adequate funds and resources. Meaningful youth participation is key to effective and successful SRH programs. I want to wish everyone a pleasant remainder of the conference and to express the hope that soon more of my peers will be standing where I stand, or will be working with you side by side to ensure access to SRH services for all adolescents and young people. Thank you.
So thank you for your precise and your clear recommendations you shared with us. And we move now to the Federation for Women and Family Planning. Who is the one?
Okay. Ladies and gentlemen, distinguished delegates and participants, thank you for the opportunity to deliver this statement on behalf of the Federation for Women and Family Planning from Poland and ASTRO Network, Central and Eastern European Women's Network for Sexual and Reproductive Health and Rights. ASTRO welcomes the UNECE regional report, which covers numerous aspects of population development and provides us with findings of the ICPD +20 review process in this region. As a member of the European civil society, I would like to address some of those issues in this report, as well as a few additional ones. One of the biggest challenges for women across the CEE region is access to safe and legal abortion. Central and Eastern Europe continues to have much higher abortion rates than Western Europe, yet the numbers are very often underreported. The findings of the UNECE review process state that abortion rates have declined across the region, with the greatest decline to be observed in the eastern part of it. Even though most countries of the CEE region have liberal laws on abortion, we are now in the center of a great backlash aimed at women's right to choose. Only a few weeks ago, Macedonia introduced new laws which restrict access to abortion, and Lithuania is one step away from introducing a restrictive law, which is almost a copy of the law existing in Poland. According to this law, abortion is legal only when the pregnancy is the result of a crime, when it poses a threat to the life or health of the woman, and in cases of fetal malformation. As the annual reports from the Polish Ministry of Health state, there were 669 abortions in year 2011, and not a single one resulting from rape or any other crime. This figure, in a country of over 38 million inhabitants, illustrates how difficult it is to access a legal abortion in practice. The Polish government constantly ignores the harmful effects of the current legislation. According to results of a study conducted by a Polish Public Opinion Research Institute, at least one quarter, possibly up to one-third of women in Poland have had an abortion at least once. This adds up to 4.1 million to 5.8 million women. As the 20-year-long experience of the Federation for Women and Family Planning shows, the effect of Polish restrictive law is not the reduction of the number of procedures, but the elimination of abortions performed in a safe, legal environment, and a great rise in abortion tourism and abortion underground rates. There are no grounds to assume that limiting access to abortion will result in lower abortion rates. This gap remains unaddressed by the regional report and thus not reflected in the findings. Moreover, the data concerning abortions in the CEE region remains to be unreliable as the numbers are underreported. The noted by the report sharp decline in fertility in the region, aging of the society, and high mortality rates provide a favorable political climate driven by demographic targets. Although abortion is one of the most contentious issues within the ICPD program of action, it is regarded as an integral component of SRHR and should be put in the center of concern regarding women's access to sexual and reproductive health services. Limiting access to safe abortion services is regarded as institutional violence against women. Selective approaches, which include prevention of unwanted pregnancies but not support safe abortion, do in fact violate human rights and lead to detrimental outcomes. Moreover, in early 2013, UN Special Rapporteur on Torture and Other Cruel, Inhumane, or Degrading Treatment or Punishment stated in his report that denial of legal abortion can amount to torture or ill treatment. Additionally, the UN Special Rapporteur on the Right to Health emphasized that abortion restrictions are discriminatory in their nature and violate the right to health. Astro Network urges governments of the region to take women's right to a free choice into serious consideration and respect their human rights as a whole. I would also like to applaud the youth delegation on their call to action and also including legal and safe abortion in their statement. Thank you for your attention.
Yeah, thanks a lot. And I move now to the last speaker or intervention on my list. It's the International Federation for Family Development.
Thank you, Chairwoman, distinguished delegates, ladies and gentlemen. The International Federation for Family Development is a non-governmental, independent and non-profit federation that has promoted initiatives in favor of families in 65 countries of the 5 continents, half of them in the UNECE region. We have been working for more than 40 years now, benefiting more than 50,000 parents every year through our family enrichment programs. From our experience, we have repeatedly proposed to set empowering families as part of the development goals to ensure that the time, effort and money families invest in their children find social, economic, political and legal incentive by the society benefiting from them. As the UN Secretary General mentioned in the International Conference on People's Empowerment and Development in 2012, the long-standing efforts of United Nations to protect human rights, promote job creation and obtain improved access to water, sanitation, energy, education and healthcare all have empowerment at their core. The goal of ensuring that people have the opportunities they need to live better lives in dignity and security. But we're also exploring new frontiers of empowerment. With the establishment of UN Women, the effort to empower the world's women and achieve gender equality received an important boost. We are also focusing greater attention on empowering the next generation through our work on youth. By looking at empowerment and development together, you are focusing welcome attention on issues that matter most in the lives of families and their communities, opportunities for decent work, the chance to enjoy basic services, and participate fully in the political life of their countries. Therefore, we feel that adding families to the agenda would be another step forward, because families are the initial and basic environments in which gender equality and promotion of youth can and should be learned and practiced. As the last session of the Commission for Social Development has stated, equality between women and men and respect for all the human rights and fundamental freedoms of all family members are essential to family well-being and to society at large. And children, for the full and harmonious development of their personality, should grow up in a family environment and in an atmosphere of happiness, love and understanding. Only with respect to human rights and equality this is possible. And while considering the diversity of family forms and the provision of socio-economic support to the family, we are promoting different studies around the 5 continents, following what the Secretary General has mentioned in one of his reports. Although there is no explicit family framework at the international level, many governments recognize families as agents of development and actively pursue family-oriented social policies at the national level. From our experience, it is only within that context that the right approach to sexual and reproductive health over the life course can be reached. Parents have the right, but also the duty to give to their children not only the reasons for the sexual education a human person deserves, but also to show it with their behaviors and personal choices and respect for freedom. That way, we will certainly allow every individual to make free choices and achieve the full of their capacities, which is the best way to define empowerment, in our opinion. The 20th anniversary of the International Year of the Family, coming in 2014, on the eve of the third year of the Millennium Development Goals, gives us an opportunity to refocus on the role of families in development. And we are trying to take advantage of it in different ways, such as organizing race awareness events and expert group meetings in Europe, America, and Africa. We expect to collect enough evidence to make some significant contributions to the Cairo Plus 20 conference, too. Thank you, Mrs. Chairwoman.
Yeah, thank you. It's good that we also had an intervention on families, as this session is about sexual and reproductive health and rights and families in the course of the life. First of all, I would like to thank all of you who came up with an intervention, and at the same time I have to apologize for those who would like to speak up due to the time that is running faster. So I'm close to hand over to the rapporteur. However, before I do it, I think we had two interesting speakers, and we still have on the podium here. And I would like to ask the three of you, just if during listening to the interventions in particular, and if there is anything you would like to add, comment, or to recommend. 1 minute. Sure. Do you want to take this opportunity? Okay.
I will take a stab at it, but I think it's been very well said, and thank you to all of the interventions. But I guess it can't go without repeating that ensuring universal sexual and reproductive health and rights is not just a mere abstract goal, but a promise that young women do not have to drop out of school because they are pregnant, that all young people receive accurate, age-appropriate sex education, and that no woman suffers or dies from unsafe abortion, and that rape and conflict will be acknowledged and addressed as we strive for peace and security in so many ways, end it forever. And as we look at the beyond 2014 and the next phase of the development goals, that we think about the implementation of the programs that these policies bring, and to ensure that what we have learned in these 20 years we bring to bear and as we write and look forward to the policies, so that programs are much more integrated on the ground, much more innovative, and as our colleagues have said, include and empower young people and women. Thank you.
Thank you. And how about you?
I think there are two important dimensions. There's the life course of individuals, and there's the life course of these individuals in and out of families. So these two dimensions are important, and it's important for governments to support the individuals in these complex family forms, and to stay neutral towards these different, to simply embrace the diversity in family life that we currently are confronted to.
Thank you.
Thank you for giving us the opportunity to speak, and I really appreciated many of the interventions. For me, the take-home message of this session as we look forward to what will happen and how we will set the stage for the next 20 years comes back to human rights for me. And it's because we have many policies, we have many programs and many interpretations of how to implement ICPD throughout the region. But if we don't have a normative international standard upon which we can all reflect in our laws and policies, they will always be somewhat subjective. And I think that if we really are serious about ensuring the right to sexual and reproductive health, then we have to base our recommendations in a human rights framework so that these cannot be interpreted with new governments, new implementers in different ways. And so for me, universal access to sexual and reproductive health in a human rights framework that ensures things like safe abortion and sexual rights is imperative if we're really going to reach the vulnerable, the marginalized, the folks that we're not yet reaching today. Thank you.
Yeah, thank you very much. And now I'm curious to hear what we mentioned and what we left out. Too much.
I'm not so sure it's what we've left out, it's what I'll leave out, because this is such a rich array of elements. I mean, issues that seem to me to arise and be really important cross-cutting ones are real stress and proper stress on the rights of individuals and ensuring that other individuals don't control their sexuality, their rights to partnership, their rights to access services, etc. But on the other hand, also individuals come together in partnerships and families. And again, addressing many of the issues to do with discrimination that are involved in some of those areas are important. The other thing I'd like to stress sort of at the outset is families do include children, and a number of people have mentioned the issues of consequences of diversity of family forms, instability of families for child development. It's not just child care. I mean, the child development is broader than that. And the other point I'll note is that I think everyone here would regret that rights did not appear in the title of this session, that it was just SRH and not SRHR, and it should have. Okay, now I've been asked to frame these in terms of successes and progress, and then challenges, and then recommendations. Now, one problem is that things overlap substantially. I mean, a challenge means you need a recommendation to deal with it. So I'll try not to duplicate too much, but it's difficult. I mean, the first success is that there seems universal commitment here to the implementation of the Cairo Plan of Action, to continued commitment to fulfilling those goals beyond 2015. But also, there's very strong commitment to wanting to move beyond some of the issues that were covered in Cairo, and I think we have to achieve that balance. There's been reductions in coercive family planning, improved access to family planning, reproductive health in some countries has been moved to the centre of healthcare reforms and integrated in a way. There's been a big shift to a rights-based approach. Healthcare system reforms have begun to include sexual and reproductive health and in a rights-based framework and improving access. We've heard a number of cases where providing good sexual reproductive health care in a rights-based context, particularly family planning, education, and safe and legal abortion, actually substantially reduces teenage pregnancies and numbers of abortions. And I think that's an important success story that we need to emphasize. We've seen some evidence of progress on discrimination, stigmatization, gender-based violence, but clearly there's an awful long way to go on that. Challenges. We need to face up to the fact, as the clip that Latanya showed of Hillary Clinton responding to the conservative agenda, that there still is a lot of opposition to many of the issues that have been advocated here today, and deal with that. Adrienne made the point, political will, sustained action and accountability is required in all this context. The big challenges, marginalized groups, young people's, but many other groups' needs for sexual and reproductive health, older people mentioned too, whole set of issues about barriers to access to sexual and reproductive health services, costs, discrimination, the role of gatekeepers, parents and others, spouses in controlling that access, the roles of laws and regulations that control and reduce that access. The rising HIV/AIDS in the region, the need for greater use of ARTs in dealing with that. that there are still restrictive gender norms and legal environments existing, that we need to emphasize the needs of all age groups, young people, adults, elders, children, when we look at these issues. We need to recognize the diversity of family forms, and for anyone who's in doubt about the diversity, look at the youth call to action. There's a footnote that lists many of the new family forms that we have to recognize and reduce discrimination against. We have to deal with issues about attitudes to sexual orientation and gender identity. We have to look at the consequences of changing family forms for children and child development. We have to deal with issues of family instability in that context. We have to deal with the issue of unsafe abortion. And again, I liked the drawing out of unsafe abortion as possibly being gender-based violence that we heard yesterday, but the health consequences of unsafe abortion. We need to deal with gender-based violence and early and forced marriage. And lastly, but by no means least, we need data to be able to measure whether we're making progress on those sorts of things. So in that context, recommendations. Firstly, fully implementing the Cairo Programme of Action and moving beyond. Secondly, absorbing and taking on board much of the detail that we heard yesterday from the high-level task force for this area, from the Youth Call to Action, and from the Vienna Plus 20 CSO declaration. I mean, all of these are important recommendations. I can't read them all now, but I think I've not heard many words against them, is how I should say. So I think we should infer that the meeting strongly supports all of those calls. We need to achieve integrated sexual and reproductive health and rights for all groups, all ages. We need to remove barriers to access, cost, discrimination, gatekeepers, legal regulation. We need to establish access to safe and legal abortion and abortion care. We need to establish access to emergency contraception. We need to establish the fact that young people and all others should have control over their sexuality and their reproductive health. And we heard the CPD agreed this in 2012. We need comprehensive sexuality education, including rights-based education. We need always to think about involving stakeholders in framing laws and services on sexual and reproductive health. Young people we've heard plenty about, but people who are HIV positive, sex workers, the poor, NGOs, the range is enormous, but that engagement of the wide range of people, and particularly people who actually should benefit from the services and should have the services framed for them. We need to emphasize the need for zero tolerance to gender-based violence and forced marriage. We need to enshrine a right to express sexual orientation and gender identity without discrimination that follows on from it. We need, in that context, also to look at the individual rights to self-determination, again for all, but particularly for young people, and for them to decide about their bodily integrity and have control over it. We need to look at the rights to be able to form legal partnerships for people of different gender orientations and sexual orientations. And we need to work hard to remove discrimination, stigmatization, again, on all sorts of things, whether it's sexual orientation, gender identity, being HIV positive, being poor, being of a particular ethnic group. We need to work for that. And then again, just lastly, but it's not meant to be least, we do need data to monitor all of those things. And I welcomed Anne's stress on the Generation and Gender programme, which, whilst it doesn't cover the children and some of our needs there, does cover the broad range from early adulthood, 18 or so, up into the older ages, does allow us to look at some of the intergenerational issues which are important for the family and to monitor some of these sexual and reproductive health needs. But there's a broader need for data in those forms. So, you know, the big issues: discrimination, stigma, gender-based violence, access, the rights to control and self-determination, the need to really establish and fight for sexual rights. I mean, there's paragraph 95 in the Beijing Declaration that many people seem to have lost sight of in the context of sexual rights. And we need good data to look at these things. So I'll leave it there. Thank you.
Thank you, the panelists here, for this session. Thank you all for listening. And I hand now over back to the Mr. Chairman and close the session on sexual and reproductive health and family in the life course now. Thank you.
Thank you very much, Renata. So this session's been, again, quite an interesting thing. I would like to thank all the key speakers for this particular session. Actually, we're really blessed to have such moderators for these 2 days, to be so in schedule, just a second to second. Now we're shifting to the next session, which is the third thematic session: inequalities, social inclusion, and rights. By the way, the word rights is included here in this session. So